Good morning, I'm Dr. Kirsty Boyd from Ottawa Plastic Surgery, and I'm here today to talk to you about how we select implants for breast augmentation. There's a lot of information that goes into doing this selecting of an implant, and it can be very overwhelming for people. And one of the most frequent questions that we get asked is, how do I pick from all the different options? So what we wanted to do today was tell you a little bit about different implants and some of the factors that help you to select the best implant for you. Basically, there are four things that I think it's important to cover. One is the size, one is the shape, one is the material that the implant is made from, and one is the texturing or the surface of the implant. So let's go through those one at a time. The first thing is size. Most commonly people come in and say, I want a C cup or I want a D cup, but they don't really know what's involved in that. There are some factors that limit what your options are and that can help you to narrow it down to pick the right implant for you. For example, you never want to pick an implant that's too narrow for your chest wall because that would make it look like it's a bump stuck on your chest and wouldn't look natural at all. Similarly, you don't want to choose an implant that's too wide for your chest because when you're moving your arms, you'd be bumping into the side of the implant. That's never a good thing. So the first thing and the most important thing that we do when we're picking an implant is that we take some measurements of your chest wall. And the most important measurement is the base width of your chest or the width of your breast where it meets the chest wall. Then we use that width and we look at a catalog and we use that width to determine what are the options of implants that would look good on your chest wall and would be a good fit. From there, you then want to think about your volume. And your volume is also related to your projection. Projection is how much an implant sticks out off of your chest. So implants come in a wide range. You pick your base width measurement and then they will show you. There are low profile implants, which are small and don't stick out a lot, moderate profile, full profile, or extra profile, full profile. And as you extend your profile, your implant would stick out more and your volume would increase. So that an implant might go 200 at low, 200 cc's at low, and maybe up to 400 cc's at extra full. And so that can be something that you use to help you decide, I would like to be bigger, but I need to stay within my frame. And that's how we start the size. Implants are always measured in cc's or grams, which is not quite the same thing as a cup size. Cup size can be useful, but we also have to work with your dimensions. Then you need to think about the shape of an implant. So implants come in two main shapes, anatomic and round. An anatomic implant is an implant that looks a little bit like a teardrop. From the front, you'll see that all implants are roughly round or oval shaped, but from the side, you'll see that an implant that is anatomic is fuller at the bottom. It's made to resemble a more natural, smaller breast. Whereas a round implant is a little bit fuller, and this is a fairly low profile implant, but it's a little bit fuller, and it's designed to give you a little bit more fullness or a little bit more cleavage. So picking a shaped versus a round implant is a little bit dependent on what your overall goal is. And one of the things that your surgeon should go through with you is, what are you trying to achieve with this breast augmentation? Do you want to achieve more cleavage, more upper pole fullness, or do you want to appear natural but just a little bit larger than what you are now? And that's a very personal decision and part of the long discussion that you should have with your surgeon. The next important thing is the material that the implant is filled with. So implants can be either saline or silicone. Saline is like a salt water. It's like a balloon, a water balloon. Silicone is made from actual silicone, which is a substance that's made that you might have heard bad things about in the 1960s and 70s when we used to talk about implants rupturing and spreading through your body and causing all these difficult problems. In fact, silicone was never proven to cause any of those problems, but obviously that was a scary thing for most women, and no one liked the idea of ruptured silicone spilling into their body. So the implant manufacturers went back to the drawing board and made new implants. The new implants are now something called cohesive gel. So if someone talks about a silicone implant in today's world, those implants are actually solid. I always tell people it's a little bit like a children's gummy bear. If you took a knife and cut it in half, it would have a sticky side where the cut was, but it wouldn't spill and it wouldn't deflate. When you're picking your implants, saline or silicone are both options, and there are advantages and disadvantages to each. Really, the silicone implants have gotten to be significantly better than they used to be, and so I would say that more people tend to pick silicone implants. They're a little bit more natural feeling, they're a little bit less likely to cause rippling or waves or be visible, and you don't ever hear the sloshing of the implant, which sometimes are complaints about the saline implants. Saline implants are sometimes a little bit cheaper. They do often need to be replaced about every 10 years or so, because there is the possibility that it could leak. And that also tends to weigh into people's decision making. But we do still use saline implants. Sometimes people really don't want a silicone implant, or they want to be able to have a little bit more control over the size or volume for their width. And so with the saline implants, because you fill them up, you have a little bit more control over the size. The last really important thing is the texturing on the surface of an implant. So again, I'll show you two implants. One implant here is smooth and one implant is textured. That refers to the surface of the implant. The surface of the implant can either be a nice, smooth, very mobile surface, or it can be textured. The texturing is a little bit like gentle sandpaper. The idea behind the texturing is that it helps to hold the implant in place, or it helps it to stick almost a little bit like a Velcro. And so when we're choosing implants, if you're looking at an anatomic implant, they're almost always textured because we don't want them to rotate and end up upside down. So that makes that decision easy in an anatomic implant. In a smooth implant, there are different reasons to go with smooth or with textured implants for the rounds. A smoother implant will be more mobile, a little bit more squishy. If you want to wear something that's strapless or halter, they'll shift a little bit more with your body, but they can shift a little bit more in the capsule. They're a little bit less likely to stay in place. There also are some studies that are a little bit controversial talking about whether a textured implant might have a lower rate of something called a capsular contracture. Capsular contracture is where you get a tight scar around the implant. And so that's a discussion that you need to have with your surgeon, because there's sort of ever-changing evidence in the fields of implants, and that can lead to a lot of confusion and a lot of discussion. So that's 4 factors: the size, the shape, the material that it's made out of, and the texture, that are really important when you're selecting the right implant for you. It isn't as simple as just saying, I want to be this cup. It's a discussion that needs to happen when you're going to talk about where are you going to put your incisions, where are you going to put the implant in relation to your breast tissue and to your muscles, and what implant are you going to pick that's the best for you. So I recommend speaking to your plastic surgeon, having a nice in-depth conversation where you communicate what you're interested in and what you're looking for, and they can help you to tailor pick the implant that's best made for you. Thanks.